It's the Becky and Boca Show, coming to you live every Thursday night at 6 p.m. from glamorous downtown Boca Raton. I'll show you how to live life in style in one of the country's most elegant cities, nestled right along the beautiful Atlantic beaches between Palm Beach and Miami. So sit back, relax, and let me show you how to indulge yourself Boca style. Okay, now I would like to introduce my first guest. It's Dr. Dean Dorfman, and he is a podiatrist here in Boca Raton.
Yes, actually Deerfield Beach.
Deerfield Beach,
Yes.
Okay. I know I have tried everything when I have to wear heels. I always dread it.
Right.
But I have to wear them with dresses. So I remember one time I was going to the hospital ball, and my girlfriends and I, we were going to figure out how not to make our feet hurt for this event. So we looked all over the internet, and we read that if you tape the second and third toe together, your feet won't hurt. Have you ever heard that?
You know, somebody came in my office today and taped the first and second toe together and said that
It was the second and third toe.
It was the second and third toe. Maybe. Yeah.
Okay, we tried it.
Yeah,
That
I
didn't
don't
work.
think it worked.
No,
Yeah,
we went and got like medical tape and taped the two toes together. And the theory is that then they wouldn't split, and that's what causes the pain.
No.
I ended up taking my shoes off that night, as usual.
That wouldn't work.
So that didn't work.
If you're going to wear a high heel and you wear more of a platform heel, so what it'll do is it'll kind of subdue that angle a little bit.
So you just don't want that really
You don't
high,
want that real
like with the
angle.
Louboutins.
Yeah, correct.
Yeah.
Correct.
Some people told me you can inject the ball of the foot with something.
Yes. Uh-huh.
That works?
Yeah. Well, it's become popular. What they do is they take Restylane or Sculpture that they're
that's what I
using in the face for facial fillers.
It's a filler.
It's a filler.
Okay.
And what they can do is they can inject it into the pad of the foot.
Is that a common thing? Are a lot of people doing that?
It's become more and more common. It's definitely it kind of started out the Park Avenue type of thing where women
sounds like
would,
something that's very Boca.
Yeah, it's a very Boca thing. There's a very Boca thing.
Women in Boca would be up for this.
Yeah, and it definitely does work. It's definitely an option, and more and more it's becoming more vogue in our profession to do more of these cosmetic type of procedures. It's an uncomfortable injection, but it absolutely works.
How long does it take before it works?
It's almost immediate. You'll have to go through about a week or so of discomfort on the pad of the foot. But as it kind of fills in there, it does really good as far as like adding a little cushion to the bottom of the foot.
Wow.
Yeah. The only downside to it is that it's a temporary fix. It's a 6 to 8 month type of procedure because the Sculpture is hydrophilic. So what happens is the body absorbs it, and also walking on the bottom of the foot, it'll move around a little bit. So what'll happen is it'll disperse after about 6 to 8 months, and you'll have to have it redone.
Okay, so tell me about what other things you do for women and their feet, because it is a big deal, and I'm sure most of the problems are caused by us wearing heels.
Correct, right.
Okay.
So most of the things that you see, bunions, hammer toes, other problems with the feet, they're not necessarily caused by shoes, but usually somebody has some hereditary predisposition. They'll either have a bunion or they'll have a toe that protrudes out, and then when they try to stick it into a shoe that's too narrow or too tapered, it aggravates and rubs up against those areas, and then it causes a bursitis, or it causes a blister or a corn or a callus, and those things are what become painful.
Right.
So the idea is to try to find a shoe that is a little bit more forgiving and a little bit wider, per se. Now, those aren't I know what you're looking at.
There's a problem there, doctor.
I understand that.
We have to look good.
Right.
That's the whole reason to wear them.
Yeah.
And it really is true. I've tried so many times to wear flats with a dress, like I'm not going to torture myself.
Right.
And it just doesn't look right.
No.
So we really don't have any
Understood.
choice. So what you have to do is
So you'll keep me in business
help
for
us,
you?
right?
Yeah, absolutely.
Right. So, so I've seen a lot of women and a lot of friends of mine walking around with the one cast on one foot. What is that from?
Oh, okay. Well, usually what we'll do is we'll cast a foot for some kind of an injury. So if you're seeing them walking with that little cast boot, is that what you're talking about?
Maybe it's some kind of a boot. Maybe I was thinking it was because they had bunion surgery.
It could be. Yeah,
Okay.
it could be. It could be either a bunion surgery or an injury. We're trying to kind of calm down the foot. So some of them look like almost like a ski boot.
Yeah.
And that ski boot is just immobilizing the foot. So it's not allowing the ankle to bend. And by doing that, you're not allowing motion. So if you did an osteotomy where we did a bone cut, and we put some screws or plates in there, we don't want that bone to move. So we'll put them in a walking boot.
Oh, that's why they're wearing those.
Sometimes people have chronic pain, and just immobilizing the foot for a short period of time calms things down, and we allow them to get back in the game. So
Okay.
our goal is to try. We see a lot of sports medicine. We have a lot of women that are runners and a lot of
Absolutely.
yoga and a
Boca
lot.
Raton, everybody's
Oh,
into all that
absolutely.
stuff.
So all that is kind of, we're trying to keep them back in the game. So there are things that we can do, non-invasive, non-surgical, that'll actually keep them, out there on the field and out there running and out there doing their classes without having to be operated on or need to be injected or anything of that nature.
Right. Okay, let me ask you this. Preventative medicine in podiatry,
Right.
I know is very important.
Okay.
And I have seen like older people whose toenails are kind of a mess.
Yes.
Is there a way to prevent that from happening?
Oh, absolutely.
Okay.
Oh,
What do we do?
absolutely. Well, one of the things, hygiene, the pedicures, I don't like to throw pedicures under the bus, but sometimes you have to make sure that you're having a sterile atmosphere. So they're autoclaving and sterilizing their instruments. The whirlpools are definitely sterilized and not just wiped clean. They need to either put a liner in them. Those are areas where
And
fungus.
the little fish are not good, right?
The fish are
You
not
seen
good.
that?
No, that's
A
not
friend of
good.
mine just was doing that
Yeah.
in Mexico and put a picture
Yeah,
on
I saw
Facebook.
it
I was like, oh.
in Prague, I saw that. I couldn't believe people were doing that. But,
Yeah.
it's kind of a trendy thing.
Yes.
But so good hygiene, making sure that some of the nail polishes that they're using in the salons, that they're not dipping it in and then using on every one of their patients or their clients, I should say. We have certain nail polishes that they sell that are formaldehyde free, so they keep the nails from breaking, splitting, crumbling, developing
Yeah,
fungus.
what causes them to get thicker and
The thickness is usually a fungal infection there. So if you see the nail thickening or yellowing, it's usually a fungal infection there. And we use a laser, which is working great for us to kind of like treat the fungus so that it's a non-painful, non-cutting laser. But what it does is it actually can eradicate the fungus. So we can if you catch it early, it's a lot easier to treat.
yeah, because I have known people that have gotten fungus in their toenails and they had to take a prescription medication. But
Right.
you're saying now you can fix that with a laser.
We can fix it with a laser. The prescription medication works great. Problem is it's got a lot of side effects, and it can cause some liver injuries and liver problems. So you have to do a
Yeah.
lot of blood work with it. So a lot of people are afraid to get on the
Sure.
oral medications.
Yeah. No, I would much prefer
Yeah,
the
they have
laser.
side effects to them. And then, the other thing is the hygiene in the shoes. They don't realize that fungus loves to live in dark, moist places. So you wear shoes, you sweat in them, you're perspiring in your athletic shoes, you're running in them,
Every
and
day.
then you put your feet back in them. Some people wear shoes without socks. So it's important to use some kind of an antifungal inside the shoe.
Oh. I
yeah.
have not been doing that.
Yes, that's a
And I go to the
staple in
gym
my
every
home.
day.
It's a staple in my home.
Really?
The shoes
Okay.
come off and they get sprayed.
So it's a spray, an antifungal
Yeah,
spray?
there's inexpensive sprays that can be used. We have one in our office, but I mean, you can probably get some online. That Lysol is okay, but there are some that are directly related
Right.
to antifungal. So if you allow the shoe to dry out overnight, you can use ultraviolet light is great. So some of these make these shoe
I've
trees.
seen those.
Yeah,
Are those good?
phenomenal. Yeah.
Oh, wow.
They're ultraviolet shoe trees. So if you have expensive shoes that you don't want to spray a chemical
Right.
in them, you can put an ultraviolet light and it'll kill the fungus
And that cleans
inside.
them
That
all up.
cleans them up and
Oh,
sterilizes
I
them.
might have to get some of that.
Yeah.
That's a good idea.
Yeah.
Okay, so in Boca Raton, pretty much all women work out, so they would definitely need to spray their shoes.
I would suggest that. Yeah,
Yeah.
definitely. It's a
Just
great
gym
idea.
shoes.
Great prevention. You asked me about preventing those
Yeah.
type of things.
Yeah.
So that's a great thing to do.
Okay, is there any way to prevent the hammer toe or the bunions?
Most of the time, they're hereditary. If they do, and usually they're caused by somebody having a biomechanical problem with the foot. So a flat foot is more predisposed to bunions and hammer toes than a high arch foot. So sometimes we can make devices or appliances in the shoes, orthotics, which will actually put the foot in a better position so the muscles and tendons are pulling in a better position and less likely to result in a bunion or a hammer toe. But once they've formed, they're kind of hard to deal with, so
Yeah.
they can be operated on and corrected. It is, it's surgery. And
Right.
I always tell people it's the only part of the body you operate on and you walk on it the next day.
Yeah.
So you got to anticipate you're going to have some discomfort with foot surgery. Yeah.
I bet. Now, as a podiatrist, what is it, below the knee or what?
Our license allows us to treat skin from the hip down.
Okay.
So theoretically, we can take skin grafts from the thigh and use them in the foot. We do a lot of wound
Why
care.
do you do skin grafts?
Wound care. We see some diabetic patients or ulcers and wound cares. Hopefully, we aren't seeing them in our Boca community. No, they're around.
Yeah.
And so what we'll have to do is sometimes take a graft and cover up a wound that's slowly healing. So but most of our license we pretty much do from the ankle down. So we'll do Achilles tendon ruptures, fractures, in the ankle, fractures in the heel, and then most of the forefoot, types of problems, which would be your bunions and hammer toes. Heel pain's a huge Plantar fasciitis.
Oh,
probably
yeah.
heard,
I know people that
that's
have
a
that.
huge.
Yeah, when your feet hurt, it just ruins your life because
It does.
you
It does.
need to walk around.
It does. Well,
So
people are so athletic, and they're trying to get out, and they're trying to
Mm-hmm.
get on the get on the beach and run and things. And if you can't,
Right.
it really then you start to gain weight. It's a kind of a slippery slope. So
Right.
our goal is to try to get people out and keep them in the game. We do a treatment called shockwave or EPAT, and what it does, it's high energy pressure waves that we can direct at musculoskeletal injuries.
Oh.
And what that does, it kind of progresses the healing process, and it does it really fast. So we work with a lot of runners and triathletes, and it keeps them running, and they still improve, and they heal as they're still running. So I
Wow.
got somebody that's training for Boston Marathon, and they don't want to stop, because they're in the middle of their training.
Right.
We could treat them, and they can still actively heal. It's a really cool technology while still training, and then get better after or during the race. Yeah.
Wow, yeah, I bet that would be important for runners.
Yes.
So I want to learn about preventative medicine for
Mm-hmm.
feet because I don't want to end up like these poor people that can hardly walk and their feet look destroyed.
Right.
So what's something I should be doing now?
Well, I mean, the hygiene, definitely. We talked about the foot hygiene, making sure the shoes, the skin and dermatitis. So you want to definitely make sure your feet are clean. Cleaning between the toes are very important. So some people blow dry between the toes because athlete's foot tends to get in
Oh.
between the toes.
Okay.
That's a good treatment. There are various different exercises, like just taking your toes and trying to pick up a towel with your toes and strengthening those small intrinsic muscles on the bottom of the foot really can strengthen your foot, and that would be helpful also. Stretching exercises where we stretch the Achilles tendon so you get less likely to have plantar fasciitis or Achilles tendonitis.
What is plantar fasciitis?
There's a band of connective tissue that runs along the bottom of the foot, and it's very elastic when we're younger, but as we get older, it loses elasticity. So what'll happen is as you start running or more active, or if you gain weight, or if you have a flat foot, if you put too much stretch on it, it'll actually start to create micro tears.
Ouch.
And those tears, you present as heel pain. So basically, you get up out of bed. A lot of people say, I get out of bed, and the first few steps out of bed hurt. That's classic of plantar fasciitis.
And it hurts what, right in the heel?
In the heel, yeah. It's
Okay.
kind of like that, what we call the medial side of the heel, the inside of the heel. And then it'll progress. And if left untreated, it gets very, very painful and very debilitating and can affect, athletes can't get back into, can't train.
Right.
It even becomes painful to walk, so.
So, okay, so that's the heel. But what is there an injury or something on the bottom of the foot? Because I, for a long time, had one. I used to carry my youngest son on my hip, on my left hip. So I think that put me off. And my left ball of my foot hurt for years.
Okay.
Finally went away. He's
So-
21 now.
Yeah.
So
Oh, that's good that it went away. There's
but
two things that
what
can
is
happen down
that?
there. Okay, so it could either be a Morton's neuroma, which is a pinched nerve in the ball of the foot, very common in women. There's a communicating branch of a nerve that comes up underneath, and it typically gets trapped. So you'll see it either with women that go barefoot on the hard. We have a lot of hard tile and
yes,
So
marble and wood in my house.
that's another preventative
Upstairs is
thing.
wood and the downstairs
Yeah.
is marble.
yeah, if I could give one word of advice, I would say definitely a pair of Crocs or a pair of
Flip-flops or
Bionic
something.
sandals
Yeah.
or some kind of a flip
It
flop.
really is uncomfortable to walk on those floors.
Yeah, barefoot on the tile, it
Yeah.
does a lot of damage, especially the metatarsal. Your padding, your foot wears away with time. So if you don't have the padding, we talked about those injections, so you naturally lose the padding.
Right.
If you don't have the padding and you're walking on hard marble and tile, you're going to get bursitis or inflammation underneath the balls of your feet, and that's very, very uncomfortable.
Yeah, I can tell that just by walking on it.
It's becoming more vogue in our profession to do more of these cosmetic type of foot type of procedures to try to thin the foot down. There's some California podiatrists, Beverly Hills podiatrists are advocating, narrowing the foot so it fits in a shoe better and things like that. It's a slippery slope.
Wow.
When you're doing cosmetic foot surgery, you have to be very careful because, it could look good, but it has
Yeah,
to
because
function.
that has to
it has
support
to
your whole
function.
body.
Yeah. So you don't
Yeah.
want to have a foot that looks good that doesn't bend or
Right.
hurts all the time. So
Right.
yeah.
But the sculptor is interesting because I guess that makes sense.
Yeah, that's a pretty simple thing, and it's
So if someone wanted to do that, they come to you and they get one injection.
you would do one injection, and then it would probably we would reevaluate in 3 months, and then probably 6 months, and then as it starts to wear away, we would have to do another one. Yeah.
Oh, that's an option for all you women out there that have foot pain when you wear your heels because
Right.
it makes sense.
Yeah. Well, there are some other things that are natural. If they don't want to go through the injection part of it, there are various different products that can be put inside the shoe to actually pad the metatarsals.
Yeah, like what? I was at an event a couple weeks ago, and they had some kind of a foot refresh spray you're supposed to spray on your feet before you wear heels. And I think it had lidocaine in it.
Oh, okay. Well, yeah.
But
So numbs the feet.
I was
yeah.
talking to my husband, who's a doctor. He said there's something, lidocaine patch.
Yeah.
And he says, what if you put that inside your shoe? Like the whole, I'm trying to figure out what.
Numb the whole bottom of your foot,
right.
and then do all the damage, and then when it wears off,
just when you're going out.
Right.
My friend Lisa owns a women's boutique, and she sells the Louboutin shoes. And she said some woman told her that she has to drug herself when she goes out wearing those shoes.
I believe
That's the only
that.
way she can spend the whole evening in those shoes.
Yeah. Well, you know what? It's amazing to me because my wife does the same thing. She'll go into a store, she'll go, these are beautiful shoes. She'll try them on and go, oh, they kill my feet. I'll take them. I'll take them. And I'm like, are you serious? So it's great.
I totally understand that.
Yeah,
because,
you get it.
But you're right. The angle on the Louboutins is incredible.
Yeah, it is. It just puts those metatarsals. So we have a normal 10-degree declination of the metatarsals. Mm-hmm. So you can get to 25, 30 degrees. You get beyond that, and you're really walking on, you're really hyperextending your bones. So you're walking right on the, there's something called a plantar plate that runs underneath the bottom there. If you overdo it, you can tear that plantar plate. Ooh. And then you predispose yourself to getting kind of crossover toes, and that's not a good look. That's not a good look. No, that's not worth it.
I know I borrowed a pair of Louboutins from her store to take some photos for something I was doing. And I only wore them while I was setting my camera on timer, walking in front of the camera. So they take a picture of the shoes, walking back. So I'm only going like 4 feet. And in like 20 minutes, I could not wear the shoes anymore. I wasn't going anywhere. I was right in a 4-foot area, but I just don't know how women can wear those.
Amazing, isn't it?
It is, but they buy them.
They do.
And they're not cheap.
Yeah, it's a very popular shoe.
Yeah.
They're not
crazy.
going out of business. No.
Okay, what else do women come in to see you for? What's the most common thing?
I would say probably the 4-foot stuff, the neuromas and the ball of foot pain is a common thing. The athletes are going to definitely have heel pain, Achilles tendonitis, and then the fungal toenails is a huge one. Women just they just don't like that. They don't like that look. And usually they discover it. What'll happen is they'll take they wear polish all the time, so your toes should breathe. And they should see the sunlight. UV light is excellent for killing fungus.
So even just having nail polish on your toenails,
you're hiding. They're not breathing. So
I can't remember the last time I didn't have.
So when you take that polish off, sometimes, and if you see a lot of like white chalky spots in there, that's a superficial fungus developing on the nail.
Wow.
So that can be easily treated. We can file that away, and we can use some chemicals or topical antifungals and take care of that. But if it starts to get underneath the nail, then it has a vehicle to hide. It hides underneath the nail, and it's kind of sealed up underneath there. And that's the one where the pills or the lasers are starting to be needed because it's really hard to get to.
Right.
Yeah. So.
And how does somebody know if they have that? Only visually?
It's visually, yeah. It's a visual. You'll see kind of either loosening of the nail, lifting of the nail, thickening of the nail, discoloration. Typically, when you take the polish off, some of these ones that have heavy formaldehyde in them, they're going to discolor your nails. So you have to be careful with that also. So they do make non-formaldehyde-based polishes and removers also that are a little healthier for your nails.
Yeah, I've seen those. I had a guy on here, I think it was last week. He brings medical, he calls them medical miracles from other countries and tries to get patents in the United States.
Right.
And he had a prosthetic toenail. Have you ever heard of this?
No.
Wait, is that something you could use in your practice?
Well, we don't have people.
It's for someone who's missing a toenail,
Yeah.
and I guess that happens. And because we're in Florida and people wear sandals, and you would see
That's exactly what the
you
problem
can
is.
take this prosthetic toenail and implant it in the toe, and it will stay there.
Right.
You can polish it and everything.
Well, there was a company that came out that had nails that we can actually put over, and if somebody lost a nail or came off skiing or something like that, and we were using them for a while, but I found that what they were doing, and the same thing with acrylics, if you put a fake acrylic over it, it really harbors the fungus up underneath there.
Yeah,
so
I don't
even though
like acrylics.
cosmetically it would look good, I would say do it temporarily, but if you leave it on there, it's just a real vehicle for that fungus to really get, so then when it comes off, what's underneath there is just a disaster, and then it becomes even harder.
Well, this one wasn't supposed to be temporary. This was for somebody who had totally lost the toenail.
Well, that happens with chemotherapy. Sometimes they'll lose nails, so that would be or we'll see runners, triathletes, runners, marathoners, something like that, because of the constant pounding in the shoe, they'll lose their toenails. They tend to
Wow.
bleed and lift up, and they come off. In fact, some runners opt to have them removed permanently. We can do that.
Really?
And have no toenails because they're
Ooh.
so tired of having these bloody toenails. I'm sorry.
But would they come back or no?
Well, we can kill the root of the nail. We can put a chemical in there so the root is gone, so the nail never grows back.
And runners want that?
Some of them do, yeah.
Wow.
Yeah. Not a great look. Yeah.
No,
It's not a Boca look.
No.
Yeah, definitely not.
No, can't wear that in Boca.
No.
Oh my goodness. I did have one experience once. I was at the gym lifting weights and I dropped one right on my toe, and I did lose my toenail.
Right.
And that was like 8 months or so before.
Yeah. Well, it takes
grew back.
12 to 18 months for a nail to grow from its base all the way out. So if you lose a nail, it's going to take a while. The other thing is when you traumatize a nail like that, you're now exposing the underlying root to fungus or so it can easily get infected. So anytime somebody has trauma to the nail, I always follow them up with a topical antifungal, and I make them use it until that nail completely grows out, because it's a lot harder once it grows in with the fungus and they come in and go, look at this nail, it's not right.
Yeah.
So it's a great way of doing it. But trauma to the nails is one of the most common ways of getting a fungal infection.
Wow.
Yeah, so it could be repetitive trauma, wearing tight shoes, skiing, hiking.
Well, another thing with wearing high heels, it's usually when I wear them, it's my toes that hurt.
Right.
Because they're just.
Yeah, they're jamming into the tip of the shoe.
You got anything for that?
Don't wear them. No.
Don't wear them.
Don't wear them. You're throwing me off the show, right? Yeah. No, that's a tough problem. Yeah, because you're on that angle.
Gravity.
Gravity. You're going to just be pushing those toes right into the tip of the shoes.
Sure.
Not much you can do for that. That's another thing when people buy shoes, especially athletic shoes. I always advise them to have like a thumb's distance between the tip of the toe stand.
Oh.
The rule
you
of
have
thumb
room
is
in
to
there.
go if you're going shopping for shoes, you should always shop towards the end of the day when your feet are most swollen.
I didn't know
That's
that.
a good point. So
Okay.
even for dress shoes, because your feet are most swollen towards
By
the end of the day.
Okay.
So if you get them early in the day, and then now they're too small.
Right.
And then the rule of thumb is you should be able to wiggle your toes in an athletic shoe. I mean, a dress shoe, it's kind of hard. Wiggle your toes inside the shoe, and then you should have about a thumb's distance from the tip of the toe to the shoe. So,
I didn't know that.
Yeah, and then the
Okay,
other
that's
thing
good
is
to
that
know.
a size, like people get really caught up with an 8 to an 8.5. An 8.5 is about a 16th of an inch. It's not half an inch, or like one size is not going up a whole inch. So some people are really, women especially, because when they're pregnant, their feet tend to splay and get larger.
Yeah.
So what happens
My
is they
feet
really
got
freak
bigger with
out.
each kid.
They freak out.
Yeah,
I'm
that
like,
is
and now
something
I'm
to
wearing a
freak out
9.
about.
I never wore a 9. What's the
Right.
matter? My feet are growing. I'm like, they're not growing. Your ligament, your
So
body's.
what happens? The bones stretch out?
Well, your body's starting to get ready to give birth. So everything, all your collagen, elastin becomes more flexible. So the same thing happens with your feet. So you're putting added weight on, your center of gravity's changing, your feet become more pliable, and they just flex a little bit more. They get a little wider, they get a little bit longer.
Yeah, I remember
So-
that happening to me. I was not happy.
No,
and I was expecting
no.
them to go back after I had the kid,
No,
but
it
they
doesn't,
didn't.
doesn't go back. That's a
So
permanent thing.
I had 2 kids. I went up a whole size.
So you have to throw all those other shoes out, right?
Yes, yeah. And I haven't thrown out the good ones. I still have those.
You still
I'm
have
hoping
them.
one day.
No, not going to happen.
Don't go back?
No.
Okay, we have a few more minutes here. Anything else you want to tell us that women should be interested? What kind of care should they be taking with their feet? I mean, do they need to check up early on to make sure everything's okay? And
It's probably not a bad idea. Younger children, we always like to check their feet and make sure that they're not, overpronating, which means really flat feet, because there are some predispositions. They're predisposed to various different foot problems. With women, I mean, I don't tell people to come in just to have their feet
Yeah.
checked. Usually when you're having a problem, you'll know you're having a problem.
sure.
And I'm happy to discuss it with you and give you some advice on types of shoes or types of activities that would help prevent it. Prevention's always the best way.
right. Now, do you consider pedicures prevention? Is that a good thing?
I think pedicures are great.
Trim the
I think
cuticles and all
pedicures
that?
are great. That's a good point you asked. The cuticle thing, really, when we were in medical school, they never trained us to push cuticles back in
Really?
toenails. Now, I know they do them in fingernails, but now I have people, I get a lot of pushback because what they're doing is they're pushing the skin in the base of the nail. We call it the proximal part of the nail, and a lot of times they create infections. They're pushing, And the other thing is when you go for a pedicure, they are not doctors, and a lot of times, they may be from another country, and their English might not be perfect, and they're like, "Oh, I can do it," and they get people into a lot of trouble trying to
Yeah,
dig out
sure.
ingrown toenails and do different things
Right.
in medical,
Yeah,
surgical.
you got to know when you should go to the
You have
podiatrist.
to- yeah. And people ask me, like, how do I know if a salon's clean? I go, do you go to a
Yeah, how do you
restaurant
know?
and you walk in and you're like, ugh, or you go to the bathroom in the restaurant and you go, I don't think we need to eat here.
Yeah.
If you walk in there and you get that
That
feeling,
vibe.
I would
Okay.
suggest probably, yeah. And then I'd always ask them to see their heat sterilization. They autoclave the instruments.
Oh, okay.
And I'd also ask
That's
them.
a good point. I've never asked
I would
about
definitely.
that.
Some people can actually buy their own instruments and bring them there.
Oh.
And then have, they're so they know that they're always using their instruments on them, because you can definitely spread infection.
I would think so. Okay, tell us how people can get a hold of you if they want to find you.
Okay, so I'm very close to Boca. I'm right on the border. I'm on
Okay.
Hillsborough Boulevard. Between my address is 820 East Hillsborough Boulevard. So I'm east by Federal Highway, between Federal and Dixie, but in Deerfield. And my phone number is 954-481-3525. Website is East Ocean Podiatry. And they can look us up anytime. We start 7 a.m. in the morning. I'm the early bird,
Wow,
so
that
I'm
is
seeing
early.
patients 6:45, 7 o'clock, and I have a partner to practice, and he'll go to 7 o'clock in the evening. So we have extended hours, which works great.
Oh, that's nice. So people can get in there. no
Yeah,
matter what.
the working people and runners and things that love to come early in the morning. So, and then the working people like the late hours too.
Okay.
But early seems to be great because they can get in and out.
All right. So this is Dr. Dean Dorfman, podiatrist, right here in Deerfield Beach. If you have any problems with your feet, go and see him, and hopefully we'll be able to wear heels forever. So we're going to go to break now. Thank
Okay,
you,
great.
Dr.
Thank you.
Dorfman, for coming in.
I appreciate it. Thank you.
And have a
Okay.
wonderful weekend.
Thank you.
See you next week.